Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. And here we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 hello. Welcome to Abby Tyler's Healthy Living. My name is Abby Tyler, your Healthy Living NP. How are you guys today? Hope all is well. And notice that some people have been complaining that they're not getting notifications. Please make sure your notifications are turned on. Okay, that says all postings, okay? Because sometimes it just says highlights and it won't go on with regular posting. So Tuesday I'm on live at 7 p.m. Eastern, and then I also put Abby's Daily Dose during the week, maybe 2 or 3 times a week. Like I said, I've been busy with my professional and personal obligations recently. So, but I'm here today to go for the show. So happy, 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 happy day again. All righty, welcome. Invite your friends. Today, I didn't put the topic up before, but today's topic is questionnaire your provider uses for diagnosing. Okay. Some, when you go to the doctor's office and we ask you all those questions and all that, we need that. It's important. We need that in order for us to come to our diagnosis. Okay. So, as always, my disclaimer I am a provider, but I'm not your provider. So, please do not make any changes to your regimen without checking with your own provider first. Okay. And share the show, share the show, share the show. Okay. Let me get in here and I'm going to put my notes in. Okay. Alrighty. So I want to put my glasses on too. Okie dokie. Alrighty. So again, going right into it. For those of you who are watching me from Focus in Liberia, I stream directly there. Welcome also. And also from YouTube and other places. Share the show now and also later. Okay. So, but please share the show for me. Okay, so did you know one of the tools that we use again when you come into the doctor's office, what an emergency room, doctor's office, or specialist and all that too? We have to write notes. By the way, when you leave, we see us writing things down. We have to type everything out that we talk to you about and everything your diagnosis and all that. So, but one of the ways that we do that, we do in our notes. It's full part of the doctor's note. Okay, the subjective, the objective, the assessment, and the plan. So the subjective is everything that you told us, why you came in and everything you told us. Okay. The objective part is when we do the physical examination, we listen to your body or listen to the part of your body that hurts. Alrighty. And then also the assessment part is when we come up with a diagnosis. Is when we, based on what you told us and what we examine on you, we come up with a diagnosis. All right. Sometimes the diagnosis is preliminary also because let's say if you came in with something and we want to find out more about it, we'll put that diagnosis there in addition to other diagnoses too, where it's also called differential diagnosis. That's why when people come to the doctor's office or the hospital, they say, well, they're telling me it could be this, and this, and this, and this. Yes, again, like I always says, some diseases, like the symptoms mimic, they can be similar to other diseases too. So it may be this one, but it may be something else. Okay, so when we go to different diagnoses and all that too, and we try to rule out. Of course, we try to make sure the most important one, the most one that's going to affect your life and your livelihood, we want to make sure we get that out of the way first. So when you do go to the doctor's office, of course, if it's an emergency, we're going to be sending you after we ask you a couple of questions and do the examination. We're going to be sending you directly to the emergency room if we have to. Other than that, based on the other things that you come in with, then we can go through with that. Okay, so the subjective part of the notes, again, like I said, is what you told us. So basically, when you come into the office, okay, you're gonna call and say the reason why you're coming in. So let's say you come in with my right knee's been hurting me. I've been having a lot of pain in my right knee. So your chief complaint, okay, your chief complaint is your right knee. All right. So when you come in there, you will I'll come in the room, I'll see you, talk to you and everything. And then I'll start asking you. So what we use to diagnose is called OCARS. It's a mnemonic. Okay, so I'm just telling you this so you can write this down when you go to your doctor's office for your next appointment, or in case if you're in an emergency room, God forbid. Alrighty, so let me just change my things over here. Okay, so we use this mnemonic that we use that we talk to you about, and we have to ask you all these questions. So, most of the time, people say, "Wait a second, why they ask me these questions?" And they ask me more, and they asking me this. But that's important because based on what you tell us is how we come up with your diagnosis. So when you go see your provider or your doctor, again, provider could be your physician, which the doctor is a physician, or your NP or a physician assistant. Okay, so that's why I put provider over there. I just they're not interchangeable, but all providers. All right. So again, when you go there, you start talking. So I'll say, okay, Mr. Doe. Let's say we'll use Mr. Doe. You come in with right knee pain. Yes, my knee pain. They'll do your vital signs and do everything. You come in the room. By the time I come into the room to see you, I've already looked over your history. If you were already an established patient there, I've already looked over your history. And sorry, I have allergies there. I've already looked over your history. You're and if you're a new patient there too, chances are more than likely you've already written everything in the computer, and then I can review it before I walk into the room. So I looked over your history, your family history, the allergies that you have, food, drug, and seasonal allergies or allergies to pets and all that, all the medications that you're taking, any kind of surgeries you've had in the past, because if you had any surgeries on your knees before, that could be a problem later on, or it could be, and also we look at the kind of job that you do that can also affect your knee and all, so many other things that come to play in order to get to a full diagnosis. So it's not just just one thing we look at all of it, the bigger problem, okay, and your past medical history as well, and also if we have to order labs and all. So the tools that we use is called O cards. Okay, so write this down on your notebook and say. Now remember also that depending on your chief complaint, we may not be asking all these questions that's going to go through there. Okay, so based on that, we don't have to go in order. We can go back and forth depending on the way you ask the questions. Okay, and sometimes the patient will call to and say, I've been having like nausea and vomiting, and of course and lightheadedness, and then they come in and I say, oh, have you ever had this before? It sounds like something very serious that I need to send them to the emergency room. And then when they do come in and they say, oh yeah, I've been having that for maybe about 5 to 6 months now, but every once in a while it doesn't bother me that much. And so that's see the difference in between I'm vomiting and nausea and lightheadedness. Go to the emergency room as opposed to you'll come into the office so we can see you. Again, I talk to when you're supposed to go to the emergency room, when you go to urgent care, when you go to your primary care. If you missed that show, it's a couple of shows below this one. Okay. So, and for those of you watching from other places, join Abby Tyler's Healthy Living page for more. Okay, so this OLD and CART is a mnemonic. Okay, so you'll say, okay, let's go through that. Number one, so onset. Let me change that. O is for onset. Okay, so the first thing we ask you, so make sure you're writing that down. So if you have to go to your doctor, then you can say, wait a second, they're going to ask me this. So onset meaning when did the pain start? Because sometimes acute meaning like it's been maybe 6 weeks or so, meaning something's rolling you, that something is bothering you, or something if it's anything like 3 to 6 months later than that, and it's been chronic, and we can the measure the kind of treatment that we do, the determination of the kind of treatment that we do based on the answers that you give us. Okay. And sometimes, again, of course, we do a physical examination too. So the O is for onset. So we'll ask you, so by the way, when did this pain start? Okay, so we're looking, and some people might say, I get sometimes people will tell me, oh, in a minute, in about a minute. And usually I'm like, what is it? How long is a minute? Or somebody say, oh, not that long. How long is not that long? Now, some people like, I don't know the exact date, but I may ask you, okay, do you remember what you were doing when it happened? Or like, what time was it? Summertime, wintertime? Do you remember what event was going on when it happened? Oh, okay, I remember I was at my aunt's wedding. Okay, when did your aunt get married? Oh, she got married maybe thing like last September. Okay, so it's been going on. Right now we're in May, so it's been going on over 6 months. Yes. It's been going on over 6 months. So that falls into chronic thing. So it's not, it's been hurting you all this time. It's probably hurting you worse than that's why you're here. Right. So, but it's not something that's so pressing that I need to hit it right away so I can continue the conversation. Of course, I'm going to continue. But usually that's when I say, okay, it's been going on for this while now. Oh, it's a chronic pain. And I may actually, so it originally started 9 months ago, or since September. You haven't had any problems with it before. You never had any else going on. You say no. Okay, so we have you on set. So I'm thinking, okay, let's go there. And the next thing I'll be like, okay, location. Of course, you say your right knee, and then I might tell you, okay, point to it. Is it on the upper part? Is it the lower part? Because remember, there are different parts of your anatomy and all that too, based on where exactly where your knee, the part of your knee is hurting. And we can when we write the diagnosis and all that too, then we can say, okay, maybe you know you can go see a physical therapist, or maybe we might want to get an x-ray and also send you to physical therapy, or maybe we want to send you to go see the orthopedic doctor. Okay, so we look for swelling and all that. That would be part of the physical examination, and of course now we do that. All right, so we'll tell you location. If you come here with your head's hurting and my head hurting, where does it hurt? Does it hurt just one side of your face at times? Does it feel like something's pressing down on your head? Does it feel like it's hurting in the back? As if you're like the pain's coming from your neck all the way, and it starts in the neck and all that. All those things mean different things, because it could be like tension headache, it could be migraine headache, and so many other things. So when we ask you all those questions, I have shoulder pain. Left shoulder, is it over here? Is it in the back? Is it lower here? Does it come from your neck? And also point to it exactly. Sometimes, especially with little kids, who will say point exactly to it. Okay, so all is for location. All right. D is for duration. Okay. So D is those. Okay. When you have this pain, how long does it last when you have this pain? All right. You'd be like, okay, wait a second. When I get this pain, usually when I wake up in the morning, I get it, and then it goes away after I start walking around a little bit. Okay. So is it just in the right knee, or just both knees? So when you wake up in the morning, you feel the pain, and then you start walking around, and the pain goes away. Okay, we're talking about it's like it could be arthritis, osteoarthritis, or we're talking about rheumatoid arthritis. So there's so many different things that be going on, and of course we're going to be asking your medical history. You haven't had any surgeries, what kind of job you do, and all that. Okay, because if you do something in dancing, sports, standing on your feet for a long period of time, all of that can contribute to knee pain over a period of time. Okay, so I said dancing, and driving also, because you're sitting there, your knees bent into a certain position for a long period of time. We ask all that too. So basically, duration. Does it hurt in the morning? Does it hurt? Does it last like 30 minutes or so? Does it hurt in the evening when you come from work and you're very tired? Does it hurt? Like long? How long does it last? Because sometimes it'd be like, yeah, it used to hurt me for maybe 30 minutes and it go away, but now it seems to be coming more often, and it's hurting, it lasting much longer, and I couldn't take it anymore. So that's the reason why I came to see you. I say, okay, so we're in the old cards. Okay, there are different variations of this, by the way, too. Okay, there's another ones like PQ, but this is the one that I'm used to. All right, so then we'll ask you, okay, for C is for characteristics. Okay, so is the pain that you're having, is this severe pain? Is it sharp? Like, do you feel it? Like, is really when you feel like it almost like takes your breath away. You feel it when you're moving. Also, like dull ache. Like, okay, I know it's there, but it doesn't bother me as much. But I know it's there, and it bothers my life. But that's not stopping me from doing the things that I need to do. Okay. Do you feel like you feeling cracking sound when you bend your knees? Do you hear any cracking sound? Do you feel like your knees falling apart, or is like doesn't feel like part of it? Do you see it? Do you feel any kind of numbness up and down your leg? Those are the things that would really, really, really like push, especially when you start saying numbness and tingling too down your leg and you up your hip. Those like trigger sounds that we're going to be listening to and saying, okay, there's something going on there. We really need to like look further into it. Okay. Again, like I said, it's a difference between whether you go to get an x-ray, go to physical therapy, or we get an x-ray and then send you to orthopedic usually wants for you to have at least an x-ray done first, so when you go see them the first time, they can have that, and then they can, if they need to do an MRI and other things like more definitive testing, then they can go ahead and do that. Okay, let me just go in here. Okay. Alrighty. So important. Numbness and tingling, you want to make sure. And if it's sharp, is again stomach pain. If you haven't, just say you having stomach pain. Okay. Well, I've been having stomach pain. And does it occur after you eat? Does it occur before you eat? Is the pain like burning? Do you feel like something's poking you? Where is the pain? Is it on your upper right side, right below your right breast area there? I mean, we're talking about your liver. Is it lower? We're talking about your appendix and all that. Gallbladder right below the neighbor there too. We're talking the spleen on your left side and duodenum on the left side. Is it lower if you're a woman? Is it much lower down there? What we're talking about, your pelvic organs, your reproductive organs, or is it hurt closer up into your chest area? Do you feel that after you eat and feel like burning, like you're burping a little bit? So all those different places, you have different organs there. All of that means something different. So it's important that way, especially when it comes to abdominal, which is like we just we say stomach pain or belly pain. It's important that when we say point to it, we know what you're pointing to, because again, there's different kind of diagnostic testing that we can send you for. It's called imaging. What are we going to be sending you for, an ultrasound, or we're going to be sending you over to get a CAT scan, or we're going to be saying, you know what, just go directly to the emergency room. If you ever should have any kind of like severe pain that is in your right lower belly area and all that, go to the emergency room, because you don't want your appendix to burst open and all that poison goes into your body. Okay. And also your gallbladder is right above that too, but your appendix will send you like shooting severe pain. You want to go directly. Don't even just go directly to the emergency room. Okay, so those are the things I'm talking about. So, the kind of pain that you're having, dull pain, aching pain, is if you're like, it's there, that's not bothering me, but I know it's there and I just needed to come and get it checked. Okay, because again, if the pain's like upper, in, your chest area, it could mean that you're just having some heartburn, gastroesophageal reflux disease, where we can put you on some medication for a couple of weeks and then see how it works out. Or we can say maybe you need to go see the GI doctor. Okay, maybe they need to do something to put a light and scope down your throat to make sure nothing else is going on in that region. Okay, again, it could be something very mild. It could be something, the start of something very severe. So it's, when you do describe that, try to describe. Don't hold back on your description. Don't overdo it, but don't hold back on your description, because we want to get a full picture. Okay. Alrighty. Again, it also like it's like if you be having dizziness and all that, we're not going to be asking the kind of pain, but we'll be asking, you're dizzy. How are you dizzy? I mean, are you dizzy when you stand up, or are you dizzy most of the time? Are you dizzy when you look down at something? I mean, is it just motion sickness, or are you dizzy when the time of the morning or the time of the night? And all that could be, yes, I'm just a little dizzy over here. I have a little bit of vertigo, meaning like a little dizziness at times, or that could be starting of like, maybe your blood pressure is running too low, or there's something going on with your other major organs that is giving you like preliminary signs that you need to go get checked. And of course, dizziness, that's also falls in with like you could be having a heart attack, or you could be having a stroke. Okay, so again, these are the questions that we need to ask, that you need to answer in a way where we can come up with a proper diagnosis. Doesn't mean that we're not going to come up with a proper diagnosis when you don't tell us this, but it just helps a lot when we can hear that, because we're going to be documenting everything you said. Okay, so when you come back and say, well, I told him that and I told him this, and it's like, no, we're going to be documenting exactly what you said. Okay, so that's the subjective part. So we'll say patient states this, patient admitted to this, patient, all of that. Okay, so it's basically what you said. All right, so it's important. Okay, so we'll go to aggravating. Okay. Alrighty. Aggravating. So what makes the pain worse? You say you have right knee pain. What makes the pain worse? Like when you go for a walk, does that hurt more when you bend your knee when you're driving? Does that hurt more when you're jumping around and playing? Does that hurt more? What makes it worse? Okay. What makes it stop you and saying, oof, no, maybe I shouldn't have done that. Sometimes the pain, when it gets to the point where the pain is just constant, that means it's already gone to where now it's like, what makes it worse? Everything's making it worse, because like I go for a walk, I make it worse. If I climb up the stairs, I climb down the stairs. If I sit down, and so the pain is chronic, the pain is constant. Okay, so it's like everything makes it worse. Okay, that's why I couldn't wait anymore. I needed to come in to see you. Okay, so either constant pain, or what makes it worse, or all the things that I do, the different activities that I do that make it worse. Okay. So the next one, for those of you who are just joining us, we're doing questions that your doctor, your provider asks you to come up with a diagnosis. Okay. So we'll come in here. I don't see any. So R is for relieving. Okay, so this will tell you, okay, what makes the pain better? When you sit down, does the pain go away? If you're having stomach pain, when you don't eat, is the pain still there? When after you eat, is the pain still there? If you're having a headache, when you take this medication, so it also could be medication over the counter too. If you take something over the counter, is the pain still there? If you let's say you go to sleep, is the pain still when you wake up? Because sometimes the pain is, when it does become constant, that you go to bed, sometimes people see you sleeping. That's one of the reasons why people don't believe some people are in pain, because some people, the pain is constant and their body has gotten used to it and they can sleep through it. Doesn't mean they're not in pain. So that's one of the main reasons why when patients go to the hospital or go to some places, and some practitioners will not, meaning like people who give nurses, doctors, and everybody else may not think the person may be in pain because, oh, you were in pain and you went to sleep. You were sleeping and you just woke up and all of a sudden you need something for pain. Because the person's in chronic pain. Okay. So basically, is the pain there? What makes it feel better? Okay. It made it feel better, but it was making me feel better for a while now, and I was taking, let's say, I was taking ibuprofen, or I were taking acetaminophen for the pain, but now none of that works. Or if you're already in pain, if you're already on pain medication, something stronger than that, the medication you're giving me, it was working before, but now it doesn't work. So I just need to tell you that the pain is not working anymore, or whatever is taking over the counter, or if I was applying heating pad, to my knee, or just kind of resting. I took some time off from work and I put some bandage on there. It's not helping. Okay. So that's why I'm here, because it's not helping anymore. Whatever was relieving, it's not helping anymore. Sometimes we'll just say, if it means don't do what you were doing that's causing the pain. Well, if you have to go to work and you have to climb stairs, or if you have to do that, if you have to go run with your kids, take your kids to different places and things that you absolutely have to do, you can't just stop doing them. We want to make sure that your activities of daily living will continue to go on to where your pain is manageable. So we'll tell you that if that's the problem, make sure you go and. So we actually all that. So okay. So we're at the relieving part. Alrighty. Let me just see here for a second. Look at the comments. So I'm not. Okay. So Larry Tur said, I'm watching from Africa, Liberia, Monrovia. Thank you, Larry. And Mike High said, Ms. Abby, thanks as always for the education, advice, and information. Thank you very much for watching too. Okay, so I will go back to my people. Okay, so I did relieving. Alrighty. So now we're gonna go into timing. So basically, we're going back again, almost like it's not so much like duration, it's timing. Okay, so it's like what time do you have the pain? Again, like I said, if you have knee pain, you wake up in the morning and the pain is only in the morning. Do you have the pain all day? Okay, so again, I say I'm going to be looking at arthritis and all that, the kind of arthritis that you have. Okay, so is the pain only in the morning? Do you have the pain when you come home in the evening? Is it because you could be like, okay, I have pain so much in the evening, and this is the kind of work that I do, and this is what's causing the pain. So remember also, again, like I said, your medication too, based on certain medications, can take some minerals and different things out of your body that you may need supplements to that medication. Now you might be also saying, why would you give me medication that's going to cause this? Well, we want to take care of the major thing first, and then the minor thing that happens as a side effect, we can take care of that. That can easily be taken care of. Let's say if you're getting pain medicine, all right, and you're paying some pain medicine will make you constipated. Well, we're going to take care of the pain, all right, and then give you other medications, natural medications mostly, not natural medications, but medications that will start from the bottom first. That will help you with the constipation, tell you to make sure you eat more fiber and drink more fluid and all that. So it helps with the constipation, but we want to make sure that we take care of the pain. So the timing you're going to be asking to, when I get this pain, I have pelvic pain, like lower pelvic pain. When do you have this pain? Oh, okay, I have it when I'm around my period, or I have it when I this, or when I eat this, when I don't eat, I have it like 2 hours after I eat. All those things is like it's not forming when you're saying that, if we're forming the diagnosis and all that in our head already. Okay, so that my right knee pain. It hurts when I come home from work. It could be like the fact that when you go to work all day, what kind of work you do that's causing the pain to be severe. When you wake up in the morning and the pain goes away after you shake yourself around, it could be some form of arthritis and all that. So it could be, and like I said, depending on arthritis, also we can do X-ray and also send you to see the orthopedic doctor. Or we may have to send you to go see the rheumatologist also, and we'll be doing some blood work. So those things are important. What time does the pain occur during the day? It could also be, again, once more, it could be constant. It's just there all the time. I'm taking too much medicine, or I'm doing everything to make the pain go away, or just manageable, and right now it's just no longer manageable. I can't do anything. Okay, so I really need to get help. So T is for timing. Okay. So in S is for severity. Severity meaning what's the pain? Let's say we ask you for pain. What's the pain level? Okay, on the scale from 1 to 10, with 1 being the least amount of pain and 10 being the most amount of pain. What is it? What would you rate it? And don't, some people are like, oh, if I say 10, they're gonna be thinking I want pain medicine. If it's a 10, it's a 10. Okay, and sometimes it's like it's a 20, especially if the pain is, something that you've been dealing with for a while and you can no longer tolerate it. If it's a 20, it's a 20. But try to be honest. Like again, like I said, make sure you give us a full picture, because you can say, the pain is so severe. Am I giving you extra Tylenol? Am I giving you extra ibuprofen? Or am I giving you something stronger? We can fall in between, or am I giving, like, they have so many different ointments, they have patches and all. So that depends on if I'm going to be prescribing you something mild, or prescribing you something maybe a little bit more and heavy, so then we can move on from there. Usually we're going to start with the mild one, but if I do my physical examination and also everything you're telling me, looking at the bigger picture, yes, I'm going to go with something a little bit stronger, and it would try to move back. Imagine, also remember, even if we give you something stronger, it's going to be for a short period of time, and we have to move back and start bringing it back until you no longer need it. And also we can still you can still follow up and all that shit, because we don't want you on this narcotic for a long period of time if you don't need it, or something stronger than ibuprofen or the acetaminophen for a long period of time. Because again, even with the acetaminophen and the ibuprofen, all right, I'm saying the generic names, all right, also your ibuprofen over a period of time, that can also affect your kidneys, and also can affect your stomach lining, cause you some stomach bleeding and all. The Tylenol, which is the acetaminophen, if you take that too many times, also too many times during the day, that can also affect your liver. So of course, we're going to be saying, are you taking the Tylenol? How many times are you taking it a day? Do you find yourself taking it a little bit more because the pain is so severe? Are you finding yourself taking this? And so based on all of that, is that's how we're going to say, okay, maybe we need to move to higher form of medication, or maybe we need to add an additional medication to that. Okay, because sometimes we'll tell you, okay, take this higher medication for severe pain. So we'll say pain from 7 to 10 or 6 to 10, you can take this really heavy medication. For pain that's lower than that, you can take the moderate form of medication, because most important, again, we want to manage your pain. We want to make sure you have good quality of life, but at the same time, we don't want you on medications that you don't have to be on. All right. So it's all about quality of life and being able to do the things that you need to do to take care of yourself and to take care of your family if you have a family. Okay. So let's go in here. So we get timing, and then also, like I said, associating, last one is not, it's not part of the old cards, but we also ask that. So your associating factors, like, is it causing you difficulty sleeping? Again, like I talked about, is it causing you difficulty going to work? Are you find yourself calling out from work? Because, and then usually that's when we start saying, is it stopping you from eating? Because sometimes when you're in severe pain, the last thing you want to do is eat, or you're eating because you're just eating to survive, just to sustain yourself. You're not eating to, you're not enjoying your food because you're in pain. Okay, especially when people who have back pain, and sometimes they're taking certain medications and it's no longer effective and all. And then that's when, of course, by then we would have sent you to see the orthopedic doctor, rheumatologist, and everybody else, all your doctors that are pertinent, specialists that are pertinent to see you. So it's important. And is it, sometimes some people might say it's causing me difficulty being intimate with my partner? And sometimes that can cause problem in the relationship, when that's not, when you're not getting it, that part. Okay, and that's when you have to also talk to, I did a show on taking, how to be happy in a relationship, not to be happy, how to manage a relationship when people were in, one partner is in chronic pain or chronic illness. So if you missed that, go back and see that. See, I put all these shows out for you guys, so you can just go back. Have a whole library of shows where you can just go in there and just plug it in. And I think I've covered almost every topic so far, but I love doing this. So again, all right. So then, based on everything you've told us, like I said, if your stomach pain, dizziness, or anything else, anything more severe, we're going to be sending you to the emergency room. Okay. And sometimes if it's like heart issues and all that, of course, we're sending you to. And based on everything else, so we need to send you to the cardiologist. I may call and say, can you see this person tomorrow? If they have an available slot, they can put you in there. Can you see this person maybe next week? Because sometimes certain doctors, it takes for certain specialists, it takes forever to get to them. I've had patients where they'll just say, okay, yeah, I called, and they'll see me. This is May, and they'll see me in November. And sometimes, so we have to look around to see if there's anybody who can see you earlier, because unfortunately, but I always also, like I said, if it's something serious, you have to go to the emergency room. You can't wait until September if it's something that serious, and we can determine that too. Okay. So based on all those things, okay, this is hurting you. Is it causing you not to sleep at night? Is it causing you to sleep too much? Is it making you depressed? Because chronic pain can make people depressed, or acute pain. It's not just a chronic pain. It can make you depressed. I mean, because you're sitting there, you're gonna be worrying, oh my God, I can't take off any more days from work. I really need to get this thing just. Do I need to take off like family medical leave? Sign up for a FMLA. You may have to take off from work because you need to go and get checked. You probably need to have surgery after that, or the doctor might say, you need to stay home and rest your knees for for maybe like a couple of weeks or so, and then you have to determine whether you can afford that. Okay, so all those things are important. And then, based on, like I said, your physical examination, we'll see how you extend your legs. We'll make sure there's nothing like crackling sound in your leg. You have to squat a little bit. How you see any kind of swelling your knees, all of that. Then we can order, based on that, we can do your X-rays or whatever else is bothering you, and then we put your diagnosis, and we write a plan of care, explain it, discuss it with you, tell you we're going to be prescribing all these medications or the kind of testing that we have to do. And we also have to refer you to go see these other specialists. And then I will go on from there. So basically, going back to what I said, all righty. So write that on your paper and say, I'm going to go see, you know what, I have an appointment with my doctor maybe this week or next week, and I'm going to be expecting them to ask me all these questions. So I'm going to make sure I have it written down somewhere. So when they ask me, I would know what to say. And she did say something about old card. So, have to show you have your phone and just have it all and say, I know she asked me that. So onset, when did the pain start? All right, location, exactly. You can point to it. And if it moves around, radiates, is the pain in your shoulder, radiates to your stomach, is it radiate down your leg, and anything else you can also ask, because we'll probably ask you that too. Okay. Duration, when the pain, you get the pain, how long does it usually last? A couple of hours, a couple of minutes, all day. Okay. Characteristic of the pain or whatever is that's bothering you, sharp, dull, excruciating, all of that would be asking that. Aggravating, what makes the pain worse? What makes it bad? What makes it hurt more? You want to ask that. Relieving, what are you doing that's causing the pain to be a little bit more relieved? But yeah, obviously you're in the doctor's office, because if you're taking something over the counter, it's no longer working, or the pain medicine that you're currently on is no longer working. And timing, what time of the day the pain occurs, and all that. And also severity. Alrighty, when you sorry, the pain scale 1 to 10. Sometimes we have these little pretty faces that we have there, where it shows like somebody's crying or smiling a little bit, and you can tell, say, okay, which one of those faces are like smiling, from smiling to very crying, especially for patients who don't understand English well, or little kids and all that too. And people with disabilities, certain disabilities, we can just point to it and say, point to that and see where does it hurt more, which one looks like, when you have the pain, which one looks like that. Okay, so we have different methods of asking for that too. And also when we're doing a physical examination, like, okay, I'm going to poke you here and see, does it hurt more? Move your arm there, let me see if it hurts with movement and all. Okay, so based on that, we do that. And again, we come over your discharge, and then we do your the full examination, and then we write your notes, and we do your plan of care. So basically, going back, what you say to your doctor already can really help in getting a proper diagnosis. Okay, and again, like I said, sometimes we have to do a couple of different diagnoses to find it, to get to where we need to, because we can say this is diagnosis, and then you come back and be like, you know what, it's still there, the medication you gave me didn't work, or it doesn't work as well as it should. So based on that, so again, old cards, remember that, write that down somewhere, and just have all that information written down, so when you go see your doctor, you can say, okay, I need to know. This is what's going on with me, and alrighty, and hopefully, when I tell you everything you need to know, you can help me. Okay, so thanks, you guys. Thanks to all of you who are tuning in today, and for those of you who will be watching later, I say thank you. I understand that this notification, Facebook goes back with the notifications, and some days you get it, some days you don't. So, but make sure your notifications are turned on. Okay. So for those of you who are watching on Focus in Liberia, I say thank you. Don't forget, join Focus Abby Tyler's Healthy Living page on Facebook, because, like I said, I go live on Tuesdays at 7 p.m. And I also put a lot of different videos on during the week too, helpful videos, help. So you don't want to miss that. And I do some postings too, other postings too. So please consider joining. Please share the show. Please share the show. Please share the show. Okay. And I'm still trying to get to my 2,000 members by July. So please invite your friends. A seasonal allergy is going to be the death of me. I just know it. So for those of you who have seasonal allergies, hope you're taking your medicine and all that. Okay. I'm allergic to grass too, by the way. Mm. So, anyways, I always tell people, I'm like, imagine I'm a Liberian, I'm allergic to grass. Back in the day, they would have been like, God, I want to don't want to say she's allergic to grass. But anyways, thank you all for watching. And I really appreciate it. Share the show, please. If you have any comments or questions, you can leave them below. I'll answer them as the days go by, and I answer them tonight if I see any. But thanks again for watching, and I wish you all the best. Happy birthday to everybody celebrating a birthday in the month of May. All right. So see you guys next Tuesday. And then also I'll put on my Abby's daily dose. Please give me a thumbs up. Please, please, please give me a thumbs up. Alrighty. Let me see here. I'm just about to go and I see a comment for a second. Oh, Jackie Jackson asking. Thank you, Jackie. Hope you watch the rest of the show. Alrighty. We'll talk to you guys later. And take care. It's cold out there. The spring needs to, get it together. But anyways, I'll talk to you guys later. Bye-bye.